So are there any particular identification markers for xerostomia or dry mouth?
Yeah, so the patients will complain more commonly of dry mouth, and what you need to do is take a detailed health history, which includes medical and dental, as I mentioned. Um, in patients you are examining for this, you will, the oral examination will reveal dry and friable oral mucosa, and the tongue will appear dry and fissured. Uh, More commonly, these patients will have, in a short period of time, extensive caries development, and that's another sign. And they are also more susceptible to oral infections. So in terms of identifying xerostomia, the identification is linked with knowing the signs and symptoms, and if they start developing based on certain causation, that is how you identify xerostomia.
So you just mentioned dental decay, right? So if a patient suffers from xerostomia or dry mouth, how can he avoid tooth decay?
Yes, so you would be mindful of telling the patient that they should avoid hidden sugars, which are processed sugars, which you find commonly in cough drops, hard candy, breath mints, sugar containing chewing gum, carbonated soda, and pop. So all of that gives you cavities within a short period of time. Also, these patients should use a prescription fluoride preparation, which means that that toothpaste will have a higher amount of fluoride than a regular toothpaste. And also, these are available as mouth rinses and brush on a gel. And these patients definitely need to maintain superior oral hygiene habits. They should brush at least twice a day for 2 minutes, and floss every day, and have their teeth checked and cleaned twice a year at least, depending on how bad their dry mouth is.
So I guess all of those treatments that we generally offer to patients with dental decay become highlighted if a patient suffers from xerostomia or dry mouth.
Yeah.
Coming to the management of this condition, can you enlighten us with some general preventive or palliative interventions?
The most important thing here would be in hyposalivation is emphasis on patient education and lifestyle modification. So patients should be counseled for their lifestyle tips and for relieving dry mouth. And you could tell them to sip water regularly, which is sugarless and caffeine free, sucking on ice chips, using lip lubricants such as lip balms every 2 hours, chewing a sugar-free gum, avoiding salty or spicy food, avoiding sugary foods, avoiding irritants such as alcohol and tobacco, drinking fluids while eating so that there's natural lubrication, or even actually having a sip of milk during food helps because of the lubrication action. And sometimes using a humidifier at night, especially if you live in a place where there's a dry air, can really help. Now, there are some specific recommendations which have been developed by the National Institute of Dental and Craniofacial Research, and those are for these patients to brush their teeth generally twice a day with a fluoridated toothpaste, flossing every day, schedule dental visits twice a year, use of a highly fluoridated toothpaste so that they don't develop caries, and also professional application of 0.5% fluoride varnish helps as well. So these are some of the specific sort of palliative or management therapies which are available.
But what about dry mouth management strategies? Are there any product recommendations?
Yeah, so in terms of the strategies, as I mentioned, increasing the water intake throughout the day, having smaller sips of this and adding moisture to the air and humidifier, using the lip balm, not using tobacco or alcohol, avoiding strong toothpaste, which are very minty or menthol-like, avoiding mouthwashes which have alcohol. These are some of the strategies. But when we talk about specific product recommendations, you have salivary stimulants available, which should be considered, which are sugar-free chewing gum, candies and mints, which are used to stimulate the salivary output. Also, there are some oral secretagogues which are available. I don't know whether they're available in every country, but they are FDA approved, and you could look into those. And you have a whole range of artificial saliva substitutes and oral moisturizers, which are available, for example, is the line of products from Biotin, which are easily available. Diet modification is very important, and you can, as I mentioned, you can not only use milk during your meals to help the lubrication, but another thing which really helps patients is using coconut oil. So if you swish edible coconut oil for about 10 minutes and spit out or swallow, this allows for tissue hydration. And apart from that, there are a plethora of products which are available in terms of recommending to the patients. There are also some medications which are available, such as systemic cholinergic agents, such as pilocarpine, which is usually 5 milligrams or 7.5 milligrams. But again, these need to be prescribed by someone who has the capability to prescribe them to the patient and not have any sort of adverse reactions. Then you have the highly fluoridated products such as Colgate Prevident, which is 5,000 plus, and this is not over the counter. This is usually prescribed because it has a high amounts of fluoride. And you have other squiggle enamels savor toothpaste, which has again high fluoride content, which allows for the patient to maintain oral hygiene and not develop caries. So see, these are some of the products which are available in the market. And as a general dentist, you might want to develop a strategy for your patient, and some products might actually sting the patient, so you might have to change the product. So there's no fixed recommendation for individual, like for all patients, but it is more an individualized sort of an approach.